Welcome to Harlow on Healthcare. I'm David Harlow, and I invite you to join me by my virtual hearth as I sit down with healthcare leaders to discuss building the future of healthcare. Today, my guest is Kim Johnson. Kim is the Director for Clinical Consultants at Vivify Health. Kim's been a nurse for 25 years, starting in the emergency room and intensive care units, and she's transitioned along the way to after-hours triage, and from there to focusing on telehealth. A few years back, she was tasked with building a national 24/7 virtual care center for Trinity Health at Home, a program that's been in the national spotlight as a successful remote patient monitoring program. Kim joined Vivify Health in 2019 and is the Director for Clinical Consultants. Kim holds a Doctor of Nurse Practice. Kim, thank you for joining us and welcome.
Thank you, Dave. I'm excited to be here today.
So tell me a little bit more about Vivify Health.
Sure. Well, Vivify Health is a remote patient monitoring solution that was founded in 2009 by our CEO, Eric Rock, and services over 1,000 health systems, that including hospitals, home care agencies, and provider offices. Vivify offers just a variety of solutions to really engage different patient populations of all ages. The main three solutions that Vivify offers is the Plus Home Kit, our Go product, and also IVR. And I will briefly describe each of them to you. Our Plus Home is a turnkey solution. The patient receives the kit via drop ship to their home. It comes with a 4G cellular connected tablet with biometric devices. It also has built-in virtual visits, a large library of educational content and videos, and it also comes with text-to-speech for that older population. These managed kits are ideal for the senior population or that high-risk population that are not really familiar with technology. And then we also have our Plus Go, which is an app solution. The patient would use their own smart device, their smartphone. The patient's invited to participate via receiving a text message to download the Vivify app. And then from there, they easily can enroll into the program. This solution has just as many rich features similar to our Plus Home, with educational content, virtual visits, and it also uses Bluetooth biometric devices. This solution is highly scalable, but at a much lower cost. And then our last solution allows the patient the ability to leverage their landline through interactive voice response, which we call IVR. And this option really targets that population that may not have a smartphone or they don't have optimal cellular connectivity to use the home solution. So the Vivify platform, again, is an RPM or remote patient monitoring cloud-based solution. And it is a leader in connected care management and patient engagement, which is producing better outcomes and return on investment for our customers. Our customers include some of the nation's largest and most progressive health systems and employers.
So are your customers principally health systems, or you mentioned employers, health plans as well, or sort of employers, health plans via employers, if you will?
Sure. So we use both health systems and also look at employers with employees to also use our system. So in 2019, Vivify was acquired by United Healthcare.
So how has that changed things for Vivify Health, or has it changed things?
Through the acquisition, actually, it's been just a great avenue for Vivify to expand in more areas of technology, innovation, and just having more resources available to even scale our product even more. In Vivify's platform, we're really just trying to deliver a pathway to holistic remote care management through using these personalized care plans, the biometric data monitoring, the video education and conferencing, and also that text-to-speech. So part of the acquisition is really allowing us to dig deeper into the biometrics and the technology that's available for the patients to use, different types of monitoring. So we're really excited about that.
Sure. And I imagine the call for that has only increased in the past year, this year of the coronavirus. And I'm wondering how the pandemic has impacted telehealth and remote patient monitoring in general, both for patients and for nurses, frankly.
So it has definitely impacted telehealth and remote patient monitoring. And as we look back over the past 10 years, RPM and telehealth really started to gain some traction within the healthcare industry. But once the pandemic hit, it just really started to accelerate. Nationally and globally, we all know we're in some unprecedented times right now with COVID-19. Telehealth and RPM are a vehicle to bridge that gap between distance and time, and really allows the healthcare workers to provide care safely, effectively, and really in the moment. This innovation allows healthcare providers to treat patients outside of the four walls of the standard brick and mortar that they're used to, and look to treat them inside the four walls of their own homes. This acceleration of telehealth and RPM has given patients just a virtual platform from social isolation and really mental health needs during this pandemic. But yet for the nurses, RPM has really just carved out a whole new role for them to use their critical thinking skills outside of the standard buildings or offices that most are accustomed to, and is allowing them to bridge this gap between distance and time. And this bridge between distance and time has proven to be successful by reducing hospital readmissions, preventable ER visits, and nurses can provide that care in the moment. And right now, patients and consumers, they're driving telehealth. They want to be seen when and where they want to be seen. And the pandemic has really demonstrated that RPM can provide cost-effective clinical care in so many ways, and it's really made believers out of those that used to be skeptics. It showed that telehealth and RPM should not be viewed as outliers anymore or just nice to haves, but really should be incorporated as core piece of the overall patient program. And I'd just like to go really back at to the beginning of the pandemic. Many primary care offices were closed or had very limited appointments. And those providers really had to quickly shift to an alternative means to provide care to these patients. With this RPM and telehealth, started to really immerse into the clinical and patient populations. And for patients, they like to be seen in the comfort of their home. It's convenient and it's in the moment care. They don't have to wait several days for an inpatient appointment. And with RPM, they can be seen where and when they want to be seen. And for the nurses, they still can provide that excellent patient care using RPM with video visits. Nurses are building patient relationships at a different level with RPM. Instead of building that relationship in an office setting, they're building the relationship in the comfort of the patient's home. And personally, I would prefer to be seen virtually versus driving to my primary care physician's office. I don't have to drive there, wait in the waiting room, and then drive home. Telehealth allows me to stay at home, avoid that travel and wait time. It's so convenient. And telehealth will never replace that face-to-face, but it sure augments patient care.
Sure, it's definitely a bridge, or for many kinds of interactions or visits, or whether it's the question from the patient or the question from the clinician, certainly easier to do that via telehealth. So there's certainly been an increase in interest in telehealth in its many forms since the beginning of the pandemic. And I'm wondering if you've seen a significant increase in health systems or physician groups in RPM specifically, and sort of what are the steps for someone from sort of getting interested in this to actually implement a program that works within their practice?
Sure. Well, absolutely. There has been a significant increase with organizations or even physician groups wanting to implement an RPM solution. At the beginning of the pandemic, RPM or telehealth was really viewed as a temporary solution to many of the stay-at-home state orders that nationally we were seeing.
Right, and the federal government was saying, use FaceTime for telehealth.
Yes.
Right, and that didn't seem like a terrific idea. It was certainly, an appropriate response to an emergency situation, but not a long-term solution. I'm sorry I interrupted you. Please.
No, absolutely. You're spot on with that. But now that we're over a year into this pandemic, RPM is now a significant piece to the patient care models. And this past year has really just shown us how valuable RPM is for patients in the healthcare industry. And with this quick shift in providing care virtually, many organizations were really not prepared to initiate an RPM program. And, anytime, sometimes change is very difficult. And with that comes resistance to implementing new ideas or processes. And before beginning any program, best practices really drive the need to secure engaged executive sponsorship. Anyone who's ever been involved in making fundamental changes with operations at any organization, especially in healthcare organizations, really can attest to this. A strong, engaged executive sponsor really helps to encourage, promote, and sometimes where needed, apply pressure to ensure that the solutions are really adopted and followed. They kind of really serve as a taskmaster and also a cheerleader. They're able to send a message throughout the organization that this is serious. They're serious about implementing the solution and seeing that it's used. So I'll continue on just with what it entails in building an RPM program. But before implementing this RPM program, I really feel that there's 5 key questions that organizations should look at before knowing if they're organizationally ready to sail and scale their RPM program.
Okay.
Some of these key questions are, is implementing an RPM program clinically viable for their organization or practice? They need to ask themselves whether an RPM platform would work well for their patient population. And are they technically equipped to collaborate? It's so crucial to understand if RPM is technically achievable for their practice. Next, have they determined the RPM's cost effectiveness? If they find that the platform extends quality of care for the patients while increasing their return on investment, then they have their answer. And also they need to look at if they're choosing the right vendor. Finding the right vendor is of utmost importance in helping patients really successfully manage their health conditions. And then last, how can RPM improve clinical outcomes and the patient's experience? Does the program help improve the patient's health with several chronic conditions, or is it really only capable of self-monitoring? And from that, I can go into the 7 blocks to launching a successful RPM program.
Before you do that, we'll take a station identification moment here and say, if you're just tuning in, this is Harlow on Healthcare, coming to you on Healthcare Now Radio. I'm David Harlow, and my guest today is Kim Johnson at Vivify Health.
So the 7 blocks to building a successful RPM program are: 1, to know what you're trying to achieve. What problem are you trying to solve? And what metrics will indicate success for them? Are they looking to improve patient health Are they looking to improve patient health related to specific conditions? Are they trying to reduce preventable hospitalizations or ED visits? Are they trying to reduce unscheduled nursing visits for home health agencies? Or are they trying to reduce cost of care? Maybe they're trying to improve quality scores or improve patient satisfaction with their healthcare experience. So from building block number 1, we go on to number 2, which is using a multi-tenant portal to select the right location. Many healthcare organizations are interested in RPM, especially those that have multiple locations, either within the state or nationally. While it may be tempting really to address every member of the population, such as every patient with diabetes at one time, best practices show us that it's best to start small and then really build out that program from there. Building block number 3 is selecting the right populations. To ensure initial success, decision makers will want to use their own and historical data to really determine which populations will have the greatest impact on achieving the organizational goals, and then focus first on them. Building block number 4, match the available technology to the patients who will use it. This next step is selecting really the appropriate technology that the patients will use. Once the target population is chosen, it's time to look deeper into who makes up that population. Start by identifying the at-risk, the rising risk, and the high-risk patients within that population, and then really develop a general profile of those patients. And really some of the areas to consider are age, the general health of the patient, the comfort with technology, and really the mobility. And next is building block number 5, and this is to establish the logistics for those self-contained kits. And this is working with self-contained kits. It does add other elements to consider. The logistics of getting those kits to and from the patients, along with the work required to really connect those kits to the clinicians and who will be monitoring them. A lot of times we see this burden fall on already overworked nurses. While that approach may suffice in an RPM program where there's only a few dozen or so kits to manage, it severely limits the ability for that organization to quickly scale the program. And a much better approach is to really assign a single kit logistics administrator. And then they have that person really work with the vendor with an end-to-end logistics model built into their platform. And following this path shifts the burden of getting those kits to and from the patients and setting them up, from the organization's nurses to professionals at the vendor organization who really focus on these operations all day, every day. Building block number 6 is integration with EHRs or electronic health records. One of the most common barriers to providers adopting digital health technology, as evidenced by a 2019 study of existing literature, is a lack of integration with clinical workflows. And with this, as a result, one of the keys to success for any RPM program is that it should be easy for physicians really to order within their normal workflow. Since this electronic health record is the digital heart of healthcare today, tightly integration with the RPM program really helps ensure it will always be available as an option and easy to execute. And the last building block is number 7, which is extensive ongoing training and documentation. Many times during the sales process, most technology vendors will tout that they have extensive training they provide as a reason to purchase their solution. Yet for many vendors, training is a one-time event that occurs shortly before their go live. For a complex solution, really such as RPM, which has many moving parts, this limited exposure may be enough just to get the program operational, but it will not place it on the fast track to really maximize results. So when considering which vendor to select, providers should really look for an RPM solution that offers continuous training options in a variety of formats, including live training, online self-study, refresher training, and really any upgrade training that these customers would need. And, through the surge in acceptance, can really lead healthcare organizations to rush into telehealth and RPM without the proper motivation and preparation. But By following these 7 building blocks, healthcare organizations of all sizes throughout the United States can really begin to incorporate or expand in their telehealth RPM programs in a way that will lead them to early successes and a sustainable approach for the long haul.
Great. So that sort of leads nicely to the next point I wanted to explore with you, which is sort of what do these successes look like, in particular from the nursing perspective? What is it about these encounters that are successful both for the patient and for the nursing staff?
Sure. So, telehealth and RPM really expands from pediatrics to the senior population. And with the ease of use, RPM can really accommodate any age or population. A lot of times, many organizations are picking their top conditions such as CHF, COPD, hypertension, diabetes, and then they can expand them into other areas. But when I think about the successes and I think about how the successes are with nursing, I think about compassion, clinical assessment, and intervention, really regardless of the platform. Whether the nurse is an ER nurse or virtual care nurse, you really apply these 3 things, and actually it blankets all of nursing. When RPM first started, it was more telephonic, but now that we've added that virtual component, it's really provided another means for nurses to it has really provided another means for nurses to assess their patients. With the quality or robust RPM solution, nurses have the ability to track and trend data and provide in-the-moment compassion, assessment, and intervention with the patient. With patients being enrolled in this type of solutions, nurses are really able to intervene sooner and potentially avoid hospitalizations or ER visits. And we know patients really don't want to be in the hospital. The technology allows nurses to assess patients by video. And I can really speak to this from my experience triaging telephonically without having the capability to see the patient. I can remember when I would triage a patient telephonically thinking, if I could only see the patient. This was really the beginning of my passion for virtual care. I remember helping our virtual care program one evening and receiving a telephonic call from a patient that he could not get his tubing connected to his feeding tube. He was just discharged from the hospital and really needed to start his feeding that evening. From my experience, I knew that sometimes it's really difficult to get those tubings connected, especially with a new PEG tube. So in my mind, I was thinking that was the case. I knew the patient was also on RPM services, so I asked him if we could do a virtual visit. He agreed, and then once we connected by video, I could quickly see that the patient was sent home with the wrong tubing. I was able to contact the physician, obtain some new orders, and keep that patient home and out of the emergency room. In one, with Nurses Week coming up, there's a famous quote by Florence Nightingale that I like to refer back to, and it's, "Let us never consider ourselves finished nurses. We must be learning all of our lives." Healthcare is just very fluid and it's continually changing. Nursing is a lifelong learning as best practices continue to evolve and change. And RPM has really given nurses a voice in the virtual care world with more responsibility to utilize their critical thinking skills and help providers manage patients in their home where they want to be.
Well, that's a very positive and very sort of personal touch outcome of what otherwise might be seen as a technological intervention and something that's being interposed in between healthcare providers and patients. I think that's very positive. I'm wondering, Kim, as we wrap up, if you could think about the future and think about if you were to wake up tomorrow, finding yourself 5 years in the future, what's one thing in healthcare that you would hope or expect to find has changed dramatically?
I think an area that I would really like to see drastically change is the treatment for those suffering with mental illness. There's such a stigma around mental health that many individuals avoid getting treatment. With remote patient monitoring, they have the ability to be seen in their homes versus sitting in a waiting room with that fear or anxiety. We all know disparities in healthcare exist and really are associated with worse health outcomes. Mental health is just really an underserved population. There's still a lot of that negative stigma around mental illness. And my hope is that RPM and telehealth is available to everyone across the country, regardless of health conditions or financial status. And I was reading a few days ago some statistics from the CDC around mental illness and the pandemic. And the CDC reported that more than 2 in 5 U.S. residents reported struggling with mental or behavioral health issues associated with the COVID-19 pandemic. And, I just really feel that RPM can really impact this population in a positive way. And I just want to share one more statistic that I think is very significant in that telehealth claims have increased from 2019 to 2020 by over 2,000%. Another survey just really showed us that RPM adoption will be on par or surpass inpatient care within the next 5 years. So I'm just really excited to see where we're going with RPM and what the future holds for it. And then last, I would just really like to end with, I want to wish all fellow nurses a great Nurses Week. We enjoy the recognition and appreciation. And as we think about our beginnings in nursing and why we do this day in and day out.
Well, thank you. You've given us a lot to think about, a lot to chew on, and a lot to be happy about in terms of where we are in this Nurses Week. Thank you, Kim, for joining us today. You have been listening to Harlow on Healthcare. Join us at healthcarenowradio.com, and let's continue the conversation on building the future of healthcare together at #HarlowOnHC. I'm David Harlow, keeping the fire going and holding a seat open for you. Until next time.